In Fox 5 Health News, another warning about safe sleep for babies. A new study finds accidental suffocation is the leading cause of death in infants under a year old.
All right, joining us now, Dr. Jennifer Caudle from Rowan University School of Osteopathic Medicine. It's such an old-fashioned problem that we just can't get beyond. It's terrible.
It's devastating, and we know that since 1999, the rates of accidental suffocation has increased. This is a big problem. Now this was, and I thought this was fascinating, by the way. This is really, it's a public health message, really, what we're talking about here.
Okay.
Researchers looked at data from between 2011 and 2014 to assess, okay, how are these children accidentally suffocating?
Okay.
The most common ways by far had to do with three things. One is blankets or soft items in the crib or bedding area where a child can suffocate. The second thing is something that they call overlay. That means when a child or an infant is laying with an adult or someone else, that other person actually rolls over onto the child. And let me say this, it breaks my heart. The number one relative or person that happened to was the mother. In most cases, it was the mother. An exhausted mother, right. An exhausted mother who might have been breastfeeding or falling asleep, what have you. And then the third thing is what we call wedging. The child actually gets trapped in between, when they're laying in a bed, they get trapped between a mattress and the wall, or say the headboard and the wall. So, I mean, and this is why I say, like, I was preparing for this segment coming over, and my heart just, it just drops at this thought. I can't even imagine. So this is what I want everyone to know. We want everyone to know, right? The American Academy of Pediatrics says this is what we got to do. Keep your kids lying on their backs. So important when they're infants. They've got to be lying on their backs because the rates of accidental suffocation is a lot less than with that. The other thing is keep them in their own crib. Do not sleep with your children in your bed. Accidental rolling over and things like that is very important. And keep those blankets and other soft items, teddy bears, things like that, that if they're not old enough to lift up their head and move, they may suffocate. So it just breaks my heart. It's a public health message for everyone out there with families. Please be mindful of this.
And especially in a crib, should you put something in the corner where the mattress is, the crib, the pad, and the...
You know, that's a really interesting question. I think, and what I'm going to say with that is, I think it depends on the crib, and really what I would do for all parents out there is to check out the guidelines by the American Academy of Pediatrics to understand which cribs and what types of things are recommended and what's recommended to do. Because what may seem like common sense to us can actually be harmful.
Got it.
So, you know, that's why I say let's just be safe.
Okay.